ukimsaidia mlemavu huwa umesaidia jamii nzima, huwa umesaidia mpaka Mwenyezi Mungu mwenyewe anajua nyinyi mmefanya nini. Manake mlemavu ni mlemavu, walemavu walikokuonewa, lakini Kikoske imeletwa na akti kusaidia.
There has been some stigma. Persons with disability have for some time not been really considered. There is that tendency and feeling that the family looks at it like a curse. And of course now in that kind of perspective, then it becomes very difficult for persons with disability to thrive. As a ward administrator, our responsibility is we also disseminate county government information to the people, get to understand issues affecting the community, relay back to the county government for action. We are at a dispensation where persons with disability have now been able to get to understand their rights. There is more advocacy now than before. Awareness has been created by government and partners on rights and even opportunities that persons with disability can pick on. Our collaboration with Kikoske, we were able to get to understand from them about the program, and we got involved from that stage. Activities that they have they organized, we helped them coordinate and even got to be part of them. We have participated in activities that Kikoske organized, largely on the aspect of marginalized groups, youth and women and persons with disability. We have been engaged to explain as a government, or rather as a government office in Malindi, on how we have been looking at the issue of persons with disability. There are other interventions that happen, and one of those which we worked well with Kikoske was to sensitize persons with disability and their representatives on the County Disability Act, the establishment of the County Disability Board. The county established after that sensitization, and the representatives of persons with disability in Malindi, some of the representatives were appointed to serve in the county board. So that is one of the successes that came out of that sensitization.
The Malindi Albinism Network, CBO, that deals with 3 thematic areas. That is health for persons with albinism and persons with disabilities at large. Then livelihood, especially for persons with albinism and persons with disabilities at large. Then the last one is advocacy for persons with disabilities and PWA especially. So we advise people, our colleagues, how to protect their skin by using sunscreen. We also advise them on where to get the sunscreens. We also liaise with doctors and other professionals who take care of their skin. So I link them with the National Council through our county office, then to Nairobi. And mind you, we who are able different, we even take the initiative of mobilizing people with disabilities and those without disabilities, mobilize them to form groups. Wezesha Fund, which is offered by county. This is alone now. To the community, I teach learners with special needs. I also go around to advocate and to teach those who don't know about inclusive education. I teach them inclusive education, including the teachers. who are not trained in that field. Even educating the chiefs, the village elders, parents about inclusive education. We met Ecces, who also, helped where we could not reach. They did a lot. They brought us together. They did need analysis. We told them we persons with disabilities are not united. So we started slowly with Ecces, who joined, who linked us to even the county attorney's office, the CAC's office, and to the member of parliaments that we knew, and they mentored us. So we moved together. As we are speaking, we have a law. As we are speaking, we work very closely with the ward administrators. They call us to public participation, but prior to the coming of this case, they didn't even know us. We are not close to them. As a result of the act that allows county government to give us money, we now be able to get funding, whereby we'll sit down, learning for ourselves. As a result, sustainability will come. Access to healthcare has improved. There is increased knowledge on how and where to access the facilities. There was increased awareness of the medical practitioners. They now involve us. They are aware. They like us now after the awareness has been made to them. Also, there is a very big inclusivity within the society. This Akina Kekoske have engaged village elders, chiefs. Right now, when I pass, and I don't know this area there's a child with albinism, the village elder, cause he has been empowered by these people, which tell me, oh, Kengo's come, rehabilitation center for persons with disability. That center will also serve persons with albinism.
My name is Victoria Sande. I'm a public health physiotherapist, and normally I do the medical assessment and categorization of persons with disability. As part of the hospital, we conduct rehabilitation services, including persons with disability, of course. First, there was a lot of stigma and discrimination to persons with disability. Most of them also lacked the persons with disability cards. Most of the persons with disability live in rural areas. That is beyond maybe Chakama and the rest of the places. And their health-seeking behavior was very low. Through their sensitization of persons with disability and sensitizing some of our staff in this hospital, we are able to realize the gaps and come up with ways of how to solve these gaps. So we collaborated in terms of sensitizations, trainings, advocacy with the Ecces, and that has helped a lot. We realized that most persons with disability are now aware of their rights. So this has helped us also as an institute to also come up with ways of how best we can handle persons with disability. We've also, the government through the Ministry of Gender, Ministry of Health, coming up with an empowerment center for persons with disability. And in that empowerment center, we shall also be doing assessment of persons with disability. So there will be rooms for assessment, which will be disability friendly. They'll have their own toilets, some ramps, and enough space for them to be able to move without barriers. Because we are intending to have the assessment, the resource center as well as empowerment center in one block with the rehabilitation unit. In future, we hope to take our services to that side, the physiotherapy, the OT, and the occupational therapists. We can all be in one area, and then these persons with disability, when they come for assessment, we'll give them skills also, give them information that they really require, and also the facilities will be accessible to persons with disability. It's very key to safeguard the rights and protect the rights of persons with disability, especially in terms of healthcare, because this will be in line with the SDG motto of leave no one behind. So we are quite inclusive for everybody to be on board. Yeah, I'm very happy for Ecces coming up because they really supported us in training and sensitizing persons with disability on their rights. This is an area that was quite lacking. So we realized that now they have known their rights through Ecces. Now they're coming up and they're more assertive and more confident to talk about themselves. and they are also willing to come and seek help. Their health-seeking behavior has improved. They are seeking services. When they have a problem, they come into the hospital and we are able to attend to them. It's a multi-sectoral approach, such that when we have civil society also supporting us like Ecces, then the health department needs to train also and put in place structures that will make sure that it's ongoing. It cascades through from the top management to the lower management. We are hoping that when we are training persons with disability through Ecces, then they will also spill over the effects to others and train others so that it is sustainable. So we hope to improve in many areas. Working together with Ecces has been a blessing for us as a hospital, and we hope to continue working with them so that many people get to know their rights, and we'll also put in place structures that will be able to support whatever we teach. So out of this, in fact, I should say Ecces has made it possible for us to have a Kilifi County Disability Network through knowing and partnership, and then coming up together so that we are able to work together. It will be nice to have Ecces on board again with other partners. Then together we can envision a place where disability is not a problem to anybody. It is actually just like, as it said, disability is not inability. It's a matter of providing the reasonable accommodation.
Lessons ambayo nimejifundisha ni kwamba mtu ambaye anaishi na ulemavu ni mtu wa kawaida, anafaa kupewa opportunity because we are able. Nafasi kama ni nafasi ya kazi, tusibaguliwe tu. Sisi persons with disability of Kilifi County pia tupate representation, tupate nafasi kule county assembly ili hizi legislation favoring the persons with disability iendelee. Tunawa identify kwa community kwanza, tunawaweka kwa network, wa join all the parents, wa join na hata wale wakubwa ambao tumejaribu kuwaweka pamoja.
Walemavu ilikuwa kama walikuwa wametengwa sana. Most of time kwa sababu ya ile kutengwa wakawa wamesikia hofu ya kwamba hawataki kutangamana na watu. So baada ya hii mradi kukuja wakaelimishwa, na ile elimu iliwasaidia sana kujua kwamba hao pia ni watu muhimu ambao serikali inawaangalia. Kwa hivyo ile uoga na ile stigma ikaondoka. Nimechagua one of the village elders ambaye sasa yeye ni mlemavu na anawakilisha walemavu katika ofisi yangu. So ndio nimemtumia sana kutafuta wale walemavu wengine kushirikiana na watu wa Ecces. Kwa tukifanya mabaraza, tunaenda huko mashinani kuwaongelesha, kujulishwa zile haki zao. Kulingana vile ninavyoona wakati wa huko mbeleni mambo yatakuwa mazuri. Najua mtu kama mimi ilikuwa vigumu sana kumleta kama judge kwa baraza hapa nje, lakini through wale watu wa Ecces na zile mabaraza ambazo tulikuwa kufanya, ilikuwa it was very easy. Taka OCS ataitwa, mtu wa kotini ataitwa, wale stakeholders sasa unajua inakuwa rahisi. Wakiitwa na organization lazima wanakuja, na imekuwa mzuri sana.
Katika election ndio nilijua huu mradi umetusaidia. Kuna namba tulipewa, hiyo hotline ya Ecces ndio imetufanya sisi mpaka tukawa hivi tulivyo. Kusema la kweli, hapa kwangu Saraali na kwingine ilikuwa kukizunguka kulikuwa kuna peace. Ukituma message una gari shakuja. Mpaka mimi mwenyewe nikasema safari kurasa safari Ecces wamefanya kitu. nikatuma message, kisha nikamwambia ni emergency, haraka inatakikana. Kisha baadaye mimi nilikimbia mpaka polisi, ndio nikajua hii hotline inafanya kazi. Pale pale nilipata ile response mpaka nikasikia raha, nikasema inawaka. Alafu ukiangalia kikosi katika PWD, mimi nawapenda sana. Walitufundisha haki zetu, tulipigwa picha kulikuwa kule Takaya na tukaletewa akti, tukajijua sisi kumbe walemavu tuna haki. Tuwashukuru kikosi walivyotufanyia mpaka saa hizi. Asana pia kuna kitu ambacho pia tulifundishwa na hii mambo na kikosi, haki zetu ni zipi. Unaona katika ofisi saa hizi walemavu wanafanya nini? Wanaandikwa. Zamani ilikuwa kuni shida. Na mimi nafurahika sana hata saa hizi ukienda hospitali ikiwa huu ni mlemavu anapewa first priority kufanya nini? Kuhudumiwa. Najivunia kwa kikosi. Mimi saa hizi nashukuru nikakaa chini nikawatafuta wale kina mama ambao wanaishi na watoto walemavu. Tumetengeza kikundi na kinaitwa Heri Disable Group. Tunafanya kama merry go round, tunasaidiana. Yote ilikuwa kwa nini? Ni kikosi imetusaidia sisi. Ukimsaidia mlemavu, huwa umesaidia jamii nzima. Huwa umesaidia mpaka Mwenyezi Mungu mwenyewe anajua nyinyi mmefanya nini. Manake mlemavu ni mlemavu. Walemavu walikuwa kwaonewa, lakini kikosi imeletwa na akti kusaidia.